Psychotherapy is one of the most important contributions from psychology as a field to the knowledge and treatment of mental illnesses and commonplace distress or dysfunction that people may experience. This topic will certainly interest you if you have an interest in becoming a therapist or if you have or will benefit from therapy yourself. In the beginning of the course, we discussed the historical contributions of Freud. Both I and your textbook authors explained not only how many of Freud's ideas were incorrect, but also unscientific and unfalsifiable. But we should give credit where it's due. Freud laid the groundwork for a lot of better modern day research and practice in clinical psychology, and he basically invented talk therapy. This is the model of treatment that involves clinicians talking to their patients about their thoughts, feelings, and psychological experiences. At first, it was called the talking cure, and this became popularized because of its effectiveness. One of the other reasons we talk about Freud is because some of his ideas, especially those within psychodynamic approaches to therapy, are still unfortunately very popular today. I say unfortunately because these techniques do not have a lot of evidence to support them. They rely on a process of trying to decode subconscious processes, such as recovered memories and repressed trauma, but there's very little evidence to support the efficacy of this. Now, that doesn't mean it's not useful to talk about things like subconscious processes, for example, dreams, or do free association games. But as we'll see later, the most effective therapeutic strategies are based on a different line of cognitive work. Because Freud's theories, including the structural model of the mind as comprised of the id, ego, and superego, have largely been abandoned by modern day psychologists, I will not hold you responsible for this material and it will not appear on your upcoming quiz. Humanistic and person-centered forms of therapy became popular in the middle of the last century and were pioneered by folks like Carl Rogers and Abraham Maslow. They suggested a different way of thinking about mental illness and human flourishing that in many ways became the basis for modern positive psychology and the self-esteem movement. They suggested that sometimes people struggle because they haven't reached their full potential or they don't recognize their full potential, and that therapy should focus on helping patients to realize and express their own capabilities and creativity. Maslow coined the term self-actualization, and Rogers developed a therapeutic technique called person-centered therapy that was more passive and allowed for patients to describe what they felt was their true, authentic self and how they could achieve it. It was about identity exploration and growth, and this was only possible if the therapist gave the patient an unconditional positive regard, such that the therapist only expresses warmth and empathy. So what can we say about this mode of therapy? Well, like psychodynamic and psychoanalytic forms of therapy, this model doesn't have very much evidence in terms of research to support it, especially for severe mental illnesses like schizophrenia or bipolar disorder. That being said, one of the things that modern day therapists do is establish a warm, supportive, nurturing relationship with their clients. The idea of positive regard is part of the way that patients can open up and talk about their feelings deeply. Nowadays, this is sometimes called the therapeutic alliance between the therapist and the patient. So overall, I'd say this is a mixed bag. There are certainly elements of humanistic therapy that we want to hold on to, but ultimately it's not great for helping people with severe distress to get improvement. Now we get to cognitive behavioral therapy, or CBT for short, which is the therapeutic orientation with the most research evidence to support its efficacy, and also my personal favorite model for treatment. The premise of CBT is that thoughts, behaviors, and emotions all interact and contribute to distress and mental illness, but more specifically, that maladaptive thought patterns are at the root of the problem. This is sometimes referred to as the ABC model, with A standing for affect or emotion, B standing for behaviors, and C standing for cognitions. According to CBT, by disrupting and modifying people's thoughts, often with techniques like identifying cognitive distortions, then people benefit in terms of emotional and behavioral health. For example, if someone is catastrophizing and personalizing, which are two cognitive distortions, a therapist might direct the patient to imagine other ways of thinking that are more realistic and healthier. Cognitive behavioral therapy was developed in the middle of the 20th century by doctors Aaron Beck and Albert Ellis. CBT doesn't rely only on meetings with a therapist once a week. Oftentimes, there's homework that the patient can do on their own to practice disrupting maladaptive thoughts in the moment, reframe their thinking, and deliberately move themselves on a different behavioral path. There's a ton of evidence to support the efficacy of CBT, not just for people with mental illnesses, but really for everybody. Here's an example that I'm sure many of us can relate to, which is social anxiety and the spotlight effect. This was studied in the context of experiments, such as one where some people were randomly assigned to wear some embarrassing clothing in a laboratory game. The participants in this condition were very concerned with their appearance and how others in the group might judge them. They were basically experimentally induced to experience social anxiety. But in this study, the researchers found that only a small number of the other people even noticed what the individual participants were wearing in the first place. Most of them simply weren't paying attention. People with the embarrassing clothing overestimated the extent to which they would be observed and judged by others. This is referred to as the spotlight effect. People tend to focus on their own experiences more than others, which is part of an egocentric bias. But that should be a relief to you if you're worried about how others might think of you, because most of the time people aren't thinking about you at all. So in a CBT context, someone who's really suffering from social anxiety might mistakenly think that others won't like them, which is a maladaptive thought. And that can be adjusted to a more realistic and healthier thought, which is, I'm not the center of the world, and whatever embarrassing clothing I wear or quirky things I say probably won't make that much of a difference in the long run. If you're interested in learning more about how you can benefit from CBT, I would highly recommend this book called The Feeling Good Handbook by David Burns, which has a lot of built-in exercises that you can do to better manage cognitive distortions and live a happier daily life. In more recent years, another popular therapeutic technique involves mindfulness and meditation, which actually isn't new at all. Meditation and yoga have been around for thousands of years and were made popular as part of spiritual and religious traditions like Buddhism and Hinduism in Asia. As with CBT, there's a growing body of research evidence to support the efficacy of mindfulness-based treatments, not only for mental illnesses, but for everybody. These treatments have been used to address a wide range of illnesses, including depression, anxiety, chronic pain, and fibromyalgia. Mindfulness is a process that reflects a non-judgmental yet attentive mental state. In a mindful state, one is very aware of bodily sensations, thoughts, and the outside environment, and this awareness is accompanied by non-judgmental acceptance. Mindfulness-based stress reduction is a program which uses meditation, yoga, and attention to physical experiences to reduce stress. Mindfulness-based cognitive therapy is a form of therapy which focuses on thoughts and their associated emotions. Mindfulness-based approaches are also sometimes incorporated into other forms of therapy, including DBT and ACT. Dialectical behavior therapy, or DBT, is often used to treat borderline personality disorder and is founded on the dialectical worldview of incorporating both acceptance and change in the therapeutic process. This form of therapy involves skills training and employs mindfulness and cognitive reframing practices to correct maladaptive tendencies. For example, one skill DBT teaches patients is called distress tolerance, or ways to cope with maladaptive thoughts and emotions in the moment. DBT is similar to CBT in some regards. DBT is founded on the perspective of a dialectical worldview and tries to get patients not to see the world as a battle between extremes like good and bad, but rather that most things have some elements of good and bad in them. DBT is about trying to recognize and appreciate nuance in the world. Acceptance and commitment therapy, or ACT, is another form of therapy that makes use of mindfulness. This teaches patients to observe their thoughts from a detached perspective. ACT encourages patients not to attempt to change or avoid what they think and the emotions they observe within themselves, but just simply to be aware of them. Your textbook also talks about some emerging treatments like digital games that help people recognize cognitive biases and distortions, and psychiatric drugs that are often administered separately from therapy by a medical doctor who may have little involvement in the psychological treatments. Medications can sometimes help alleviate emotional pain and make daily life feel more tolerable. We'll discuss other new advances in therapies and treatments in another video. For now, we'll end this discussion here, and I encourage you to watch the supplemental videos on Canvas that highlight the different ways of conducting therapy.